you 2 new CDC tools, which will better show how the spread of COVID-19 is happening in the community and what prevention steps that you can take. So from our main hub, which the link is in the description below, or you can find it through our webpage as well, you want to go to CDC Tools tab here. And there are 2 tabs here at the top, COVID levels, community levels, and community transmission. We're going to click community transmission and go through this really quickly. Community transmission basically tells how COVID is spreading and how likely you are to be exposed. It takes into account cases we've had in the last week and positive tests in the last week. And what we're going to do is come down here, click that to interact. We're going to choose Montana. We're going to choose Montana and set the county as Lewis and Clark County. And basically, we're going to take a look here. Our 7-day metrics, cases have been 30 in the last 7 days. Positivity rate, look at that, 3.53%. So that is a really good positivity rate. So we'll come down here and we can see our level of community transmission is moderate. Okay, so we're going to head back over to the community levels tab right here. Community levels is a prevention step tool. So it takes into account how many local hospital beds are filled, how many people have been admitted to local hospitals, and how many new COVID-19 cases we've had in the last week. And so what you're going to do is you're going to scroll down here, click in here to interact, and we're loading the tool right here. And what you're going to do, same thing basically. Unfortunately, it's taking a little bit of time here. Go down to Montana, go over to county, hit go. And right now our community level is low. So what they recommend is that you stay up to date with COVID-19 vaccines and get tested if you have symptoms. So that in a nutshell is community levels and community transmission.
Hey, kiddo, you got a minute?
Of course, Pop. What's up?
As you get older, you may notice that your body is starting to change.
You do realize I'm 45 years old, right?
You might be feeling curious.
Are you talking to me?
You may be asking yourself, what's happening to me?
That's exactly what I'm thinking right now.
In fact, some of your older friends might already be doing it. So, I got you this from the doctor. Your mother and I have done it, and we're happy to tell you all about it.
Oh my God. You could have started with this.
Hi there, my name is Jess Hegstrom, and I am the Suicide Prevention Coordinator for Lewis and Clark Public Health. And I'm going to tell you a little bit about our new program called LOSS Team. So LOSS Team stands for Local Outreach to Suicide Survivors Team. And so what happens is whenever there is a confirmed suicide, the coroner's office will notify the LOSS Team of this death, and then the team will go directly to the scene of the suicide or the home of the next of kin and provide direct support to them. This is really important because suicide loss survivors are at an increased risk of taking their own lives due to the traumatic event. They're also more likely to adopt maladaptive behaviors such as substance use, hoarding, gambling, things that people do to stop the pain, because one thing that suicide loss survivors are typically in is a long-term stage of pain because it's so unlike any other type of loss. So what we do is we provide resources, installation of hope, and a little bit of information to help them get on a path toward healing. So the Lost team of Lewis and Clark area ended up rolling out on March 1st, and right now we're doing delayed response, but starting later this month, we will be going to the scene to provide that direct support. We're also working with a really excellent organization called the Awareness Network, and they are providing 2 free grief sessions to every survivor that we serve. So we're really looking forward to this program as being a method that survivors can use to heal, because we find that not only do people end up getting services faster, they also end up volunteering for Lost Team themselves, because there's not much you can do about your loss, but you can turn grief and hurt and pain into hope and action.
I can't count the number of conversations we've shared, talking about family, sports, even just the weather. But this conversation, I knew this conversation was going to be hard. I had noticed Terry wasn't acting like himself. He was irritable. Something was off. So I just asked him if he had been feeling down. Terry wasn't doing well, and he knew it. And then I asked him something very important. I asked him if he had thought about suicide. I asked him if he wanted me to look after his guns for a little while. He agreed. I can't count the number of conversations we've shared, but I'll never forget this one.
Hi, this is Drenda Niemann, Health Officer with Lewis and Clark Public Health. I'm going to give you a quick COVID-19 update. We have the lowest cases that we have seen since before Delta last July of 2021. So you can see in the graph here that our incident rate per 100,000 per day has dropped to about 7, and then our weekly case incidence has dropped to 52 per week, or in the last 7 days per 100,000. Our test positivity rate is also down nicely at 3.5%. We are monitoring and continue to monitor the subvariant of the Omicron variant, and we are seeing some increase in cases across the world. So other parts of Europe, for example, are seeing a slight increase in cases. We'll continue to monitor that situation, see if it will become a threat here in the United States, Montana, and right here at home in Lewis and Clark County. Our vaccine rates are holding steady, very, very small increases from week to week. We're sitting at 70% of our eligible population 5 years and older who are partially vaccinated, 63% fully vaccinated, and we have 35% who have received their booster doses. According to the CDC tool, we are at a low precaution level, which means that we recommend that folks stay up to date with their vaccine and then also get tested if they are symptomatic. So up to date with your vaccines means that if you received an mRNA dose of Moderna or Pfizer, first and second is considered your primary dose, and we recommend if you are beyond 5 months that you get that booster dose. It's the booster that's going to give you that increased protection as we continue to see the virus kind of spread around the world and our community. And then our testing center out at the fairgrounds remains open, and the testing hours of operation are posted to our website. So please tune in for our regular community briefing on a monthly basis, and we'll give you a little bit of an update on COVID and make sure that you are armed with the most up-to-date and relevant information to protect yourself and your family. Thanks, and be well.